Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
And today we have our special episode, our annual Turkey Day Talking Points. But first, Stephen, I want to ask, what are you thankful for this year?
Well, I'm always thankful for our patient advocates here at GHLF. I'm so thankful for the thousands of patients that we have that continue to advocate for themselves and patients around the country.
It's so true, especially coming off of the American College of Rheumatology conference, seeing our colleagues there and the patient community really active. It just reminds you that, we're stronger together.
Absolutely. This holiday is also an important opportunity to share with loved ones what it's like to live with a chronic condition and the vital advocacy you engage in to ensure better access to treatments and care.
And today we wanted to highlight one key topic that you can bring up with your family, something that may be going around in the news or you hear about online, and that's weight bias. So, let's just talk about what it is, why it's important to address it, and give some conversation tips.
Sure. So weight bias refers to negative attitudes and beliefs about individuals based on their body weight. The bias can manifest itself in many areas of life, including healthcare, education, and employment, and it often leads to discrimination and stigma, which can significantly impact a person's quality of life and health.
And addressing it is really important because we want to reduce weight bias. It's essential for building a more inclusive society where everyone feels, supported to get access to the care that they need, because weight bias can often lead to a lot of prejudice health beliefs amongst even healthcare providers, but those around you, and it can make you hesitant to seek care. And we want to try to reduce that as much as possible so people feel respected and compassion from the healthcare system and those around them.
So what can we do as advocates, people in the community around this topic, starting with conversations?
Exactly. Yeah. Just like we are now, you could bring up these talking points, share your experiences or stories with loved ones about the importance of treating people with chronic illness with respect and how chronic illness affects people's lives.
Yeah, and you should also understand and perhaps challenge myths, educating people about misconceptions that surround weight and health, emphasize that health is multidimensional and cannot be judged solely by one's body size.
And you could also take it a step further and advocate for policy change. There are bills like we talked about, TROA at the federal level that increases access to obesity care. You could join our 50-state network of advocates to learn more, and we could help you get involved there too.
Yeah, and I've heard people say that focusing on someone's weight or weight bias can sometimes undermine the importance of maintaining a healthy lifestyle or even continue to encourage unhealthy habits. But that's not really the point. The point is that to explain that addressing weight bias doesn't necessarily downplay one's health. You could talk about health and weight as not necessarily in the same sentence, if that makes sense. You want to foster a supportive environment that allows individuals to pursue health without fear of stigma or discrimination is the key.
Exactly. And research actually shows that compassionate, unbiased care leads to better health outcomes, which makes sense. You're more likely to seek care when you feel comfortable and follow those recommendations from a provider that makes you feel safe and like you're in really good hands. So it ultimately leads to better health outcomes to have these conversations and really foster that support.
Excellent. Well, so this Thanksgiving, we encourage everyone to start meaningful conversations with your loved ones on this topic or any topic of importance of advocating for patients and what it's like to live with a chronic condition.
And you can share your story with us at advocacy@ghlf.org. And we also encourage you to join our 50-state network and get involved in advocacy with us. We'll drop a link in the show notes to sign up.
And once again, we're incredibly thankful for the hard work and dedication of our advocates. Your passion and commitment drive change and help create a world where everyone has access to compassionate and effective care.
Absolutely. It is really the voice of patients that help affect change.
Before we go, Zoe, it is Thanksgiving. What are you looking forward to this Thanksgiving?
Oh my gosh, I love the parade, the Macy's Thanksgiving parade that's here in New York.
Nice. Are you going to go?
No, I usually watch it from the comfort of my couch.
Yes, smart.
With breakfast and a coffee in hand, just staying warm, cozy with the family, enjoying all of the floats. It's really fun.
That's a good one. That's a good one. When I was a little kid, every year we'd watch the parade, and every year I would ask to go, and every year my parents would say, maybe next year, maybe next year. And I never got to go. I want to do it someday.
Do your kids ever ask about going?
No, I can't even get them to watch it on TV. Different generation. Yeah, well, that's great. I'm excited myself to just have a couple of days to relax and watch a little football and kind of let the brain rest a little bit.
Yeah, that's what that's for, right? Good family time.
Definitely.
Also, like to say, you should be like thankful for yourself and like you're saying, give yourself that time to rest and like appreciate how far you've come in the last year.
Yeah. Well, happy Thanksgiving, listeners. And before we go, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.